My name's Jeffrey Barron. I'm an orthopedic surgeon. I specialize in spine surgery. I do nothing but spine surgery. I've been doing 100% spine surgery for about 17 years now. Well, I was born in Washington, D.C. and grew up in suburban Virginia. My dad worked for the government. Moved to Denver at age 10 and rapidly became a Denver Broncos fan. Great growing up in Colorado. You know, before Southwest Colorado was much of anything, very residential. We had tons of space to play and ride our bikes and play up in the mountains, and lived there through high school and joined the Marine Corps. Spent 6 years on active duty in the Marine Corps, which was a great experience for me. So I got out of the Marine Corps. I was 24 years old, almost 25 years old. I had started some education while I was on active duty, so I almost had a bachelor's degree completed. I started thinking that I was going to do something in psychology or psychiatry. I got a master's degree in psychology and then was interviewing for a clinical PhD and decided to study medicine. I think part of that decision was getting on a path of atonement. Let's just say the things that I was involved in the Marine Corps were maybe a little bit against humanity, and I thought getting back to serve humanity might be a good plan for me. So that got me in medical school. As soon as I got in medical school and was exposed to it, I knew I'd be a surgeon. I mean, it was just obvious. I knew that was the path. You know, I was around it and it was very attractive to me. And then orthopedics was just the right choice for me too. As I got my residency, I was again exposed to the subdisciplines in orthopedic surgery and the challenges associated with spine surgery, the difficulty of the cases, the complexity of the cases, and it was the obvious choice for me. In 2008, I had a lumbar disc herniation, significant left lower extremity pain, evil. Like the consummate old United States Marine, I just toughed it out. I went to physical therapy, I had an injection, I skillfully neglected it. That strategy failed after about 2 weeks. So I called one of my partners and I said, hey, I need an operation, man, you gotta operate on me. So I had a relatively small operation, successful. I do have some experience as it relates to patient care, and it has allowed me to tell that story a little bit and allow my patients to understand what it really means to go through some spine surgery. So it's very common for patients to project and verbalize their stress, fear, anxiety associated with having any surgery, but for some reason spine surgery may be a bit unique. You know, spine surgery oftentimes and most of the time is an end-stage solution. You should try everything you can. You should exhaust the non-operative management strategies in the interest of avoiding an operation. But when it's time and nothing else is working, spine surgery is very effective. The right choice, the right operation, the right diagnosis, the right combination of those things leading to the operating room can be very successful, and my practice would reflect that. I tell patients oftentimes, I don't make promises I can't keep. I tell them what I think we can do. I'm very fond of telling patients, my goal is to try to make you better than you are now. And when I see those patients back at 6 weeks and 2 months and 3 months post-op, and they are dramatically better than I had promised, that is absolutely life-changing for me as well. I tell my patients, when I see them, I tell them, this is why I put my shoes on in the morning. You know, that's the reason why I'm in this business, watching patients get better and absolutely benefiting from the surgical efforts that I make. I spent a long time pursuing a career and spent a long time single. I didn't get married for the first time till I was almost 40. Married a very wonderful young woman. We now have 2 children, my son almost 10, my daughter 7. We enjoy, you know, hanging out and being a family and doing our thing and off on vacation. I do have a long history of being outside and playing outside. So even as a young guy growing up in Colorado, I wasn't the traditional sports guy. You know, I didn't play football. I was up in the mountains, mountain climbing. I didn't, you know, do any real team-related sports. I played a little water polo, which was team-related. I rode my bike and tried to crash it. You know, long before mountain bikes were even created, we were crashing our BMX bikes up in the mountains. You know, learning how to do that, jumping off of anything that was possible. Grew up skiing, learned how to ski at age 11, been skiing forever. Honing my skills, doing it on and off over the years, and continue to really enjoy that. Up and away is better. Fresh tracks are always fun. Skydiving and base jumping have been a pursuit of mine over the years. The older I get, maybe I do it a little bit less, but still always trying to throw myself off of something and try to feel the wind in my hair. Always fun.